little bit of context. I actually used to be a fan of yours. Yeah, in high school, yeah. Then I started reading some Paul Krugman and some Noam Chomsky. Probably a bad idea, according to you. But
yeah,
anyways,
why would you do that to yourself?
Yeah, I know. Anyways, so here's the context. So the United States spends approximately 18% of its GDP on healthcare, most of which is spent on the private sector. Compare this with the fact that the OECD average is around 10%, with Switzerland as some second in terms of cost based on GDP, with approximately 12%, obviously 12% of their GDP. That's what they spend on healthcare. Their system is similar to ours, however, they're unique in that they have universality. Obviously, they have their own form of a federal mandate. I'm pretty sure that was recently repealed by the Trump administration. And obviously, they have nonprofit healthcare providers. And just before I get to the question, why the healthcare industry is unique, obviously it has extremely inelastic demand, and also healthcare by nature will always be somewhat expensive due to how high maintenance it is in terms of cost of medical equipment, paying for experienced and trained staff, etc. To put it shortly, it is not like other sectors with inelastic demand, such as food, obviously another necessity. And obviously, I already know what your opinion is. I used to be a fan of yours. So why ought the United States not switch to a universal system if healthcare that is either quasi-public and private, whether that be a more extreme single-payer system or a more moderate private system such as Switzerland, or semi-private public system such as Switzerland?
Right. So, I mean, I've said this before, and I'm sure if you were a fan and you actually listened to what I'd said about this topic, then what you would hear is that basically I think that the two best options in this particular area are, if you're going to have a government-involved system, it should look like Switzerland. Switzerland is the one that I've recommended. If you're not going to have a government-run system, then it should be a much more free market system. And the basic rubric that you have to use to examine healthcare is that there are three basic things that you can have. Right? Have you heard the spiel before? Yeah. Okay, so you've heard the spiel, right?
Universality, affordability, and quality.
Correct.
However, actually, according to the rankings, United Kingdom is an example. France actually has higher quality and higher affordability, and they have universality, while the United States doesn't compare.
No, because
on
they're measuring.
Okay,
so first of all, the measurements when it comes to quality, it depends on the measurement that you are using. If you take away, for example, in the United States, the car wrecks and if you take away, I think the statistic is that if you take away car wrecks and the way that we mention it and the way that we measure infant mortality in the United States, we actually do rank #1 in life expectancy. So the United States is a lot more diverse than first of all, than a lot of other countries that are mentioned in the context of life expectancy and healthcare provision. But it is also true that the United States' healthcare system is wildly underrated in terms of the sort of quality care that it can provide, particularly when it comes to things like cancer. So emergency care in universal systems is really good because it's very basic care. You walk in, you get stitched up, you leave. But when it comes to actual wait times for surgery, for example, when it comes to actual ability to get the kind of care that you need if you're available to pay for it, and for cancer, America, for example, has the #1 rate of 5-year survivability of cancer on planet Earth. Free markets are very good for what they are very good for. When it comes to universality, obviously we're going to fall behind because universality doesn't imply quality. Right? You can have a really crappy system that is also universal because it's universal, but it doesn't have to be good. As far as affordability, you have to actually look at the amount of debt that is incurred, and it depends on whether you're talking about the affordability to whom. I mean, are we talking about in the United States, we private citizens are spending an enormous amount of money on our own health care, but that's our choice. I get to choose how much money I spend on my own health care. And it is true that there is, I don't actually agree with the basic idea that there is inelasticity of demand when it comes to health care. I don't agree with that. There's actual tremendous elasticity of demand, which you see every time there's a government subsidization of health care. Right? You see when Medicare is expanded, there's tremendous pressure put on the system, which is why doctors drop out of Medicare, because they're only being paid a certain amount of money per patient. Right? If you talk to anyone in the medical field, many doctors are moving specifically away from even taking Medicare or Medicaid patients because they think the reimbursement rates are too low, because there's now a bunch of people who feel like they're covered by this health insurance, and now they can simply go to the doctor. There are a bunch of problems. I mean, healthcare is a very complicated topic, and that's why I think it's actually a little more complicated than the simplistic, okay, well, full free market in everything will solve everything. I don't think it'll solve everything. I think that a full free market would allow there to be more competition in the healthcare field. I think that better price transparency would obviously be helpful, and that's something that maybe government can actually help in terms of mandating price transparency, although I'm not sure a mandate would actually be necessary. I think that when you look at competitive services that are provided, the government subsidization of particular services has increased cost in those areas. There are these charts that are really interesting that show basically different fields of goods and services in the United States. And what it shows is that virtually everyone that is subsidized by government, the price has gone up, and virtually all of the ones that are not subsidized by government, the price has gone down, because you're creating a false level of demand that is then not actually taken care of by the government, and the price goes up. So, I think that if you're going to try and, number one, apply the French system to ours, you have to look statistically at how much money we are choosing to spend on our health care. You have to look at the regulatory systems that exist state by state in the United States, because it does differ state by state. And you also have to look at the actual lifelong choices and consequences. Healthcare is rationed in France. Healthcare is rationed in Canada. It is rationed in these places, which is why you're waiting in line 10 months for hip surgery. Optional surgeries are a lot more difficult to get in these places. So there are costs and benefits to all these things, is I think the basic answer. Sorry, it's a long answer to a long question.
Mr. Shapiro, thank you very much for coming to our school. I think that you will find it a lot better than you did Berkeley. As a Democrat myself, I think that a lot of my party would actually agree with a lot of things that you say, specifically about trade. And also, Alexandria Ocasio-Cortez's free healthcare program is basically a death sentence for me, because I've had 3 heart surgeries and I need high-end healthcare. And I think that actually we share a lot of common similarities as the silent majority of the Democratic Party. It's really a reformist group. And so what I actually asked the same question at the Pete Hegseth event for people who remember that. What do you think are the best aspects of the Democratic Party, and how can we better elevate those things to the top of our agenda?
I mean, I think that the biggest problem with politics on all sides right now, but particularly in the Democratic Party, is that the more extreme positions are also the loudest positions and are getting the most focus in the Democratic Party. Right now, I think almost as a reaction to Donald Trump, the Democrats have become much more free trade. That's a very good thing. They're suddenly anti-Russia, which I find good, if odd. That's I'm happy with that. I hope that sticks around after President Trump is gone, whether that be in 2 years or another 6. I think that the Democratic Party has, I wish that I could say that they were more moderate. I'd have to, some of the policies that you're talking about, the ones that you agree with me on, are exactly the ones that I'd hope would be elevated inside the Democratic Party. I just don't see them being elevated inside the Democratic Party all that much these days. It seems like they're moving in the direction of nationalized health care, free college education, free everything, pretty much, and no way to pay for it. So, I hesitate to say that there's a lot to compromise with in the Democratic Party, but there are some. I feel like there are some people in the Democratic Party who are being marginalized, whose voices would be better being heard. I mean, there's a representative named, I believe it's Lipinski, who's a pro-life Democrat, who will be speaking at the March for Life tomorrow. That position has been largely marginalized inside the Democratic Party. I would hope that the moderates in the Democratic Party would take the steering wheel out of the hands of the small children who seem to be running the party at this point.
So would you, if a Democrat did that, would you vote for him?
If a Democrat mirrored the positions that I like, why not? I don't care about party label. I care about the positions.